Welcome to General Internal Medicine Clinic at OHSU. This little presentation is part of your orientation, and it is focused on the quality of the experience you are going to get at the OHSU General Internal Medicine practice. The agenda I want to walk through today is first to review with you what you can expect from outpatient experience in clinic here in General Internal Medicine. And then secondly, review with you what the clinic is going to expect from you in the way of learning and serving here at OHSU. First of all, I do truly want to welcome you to this practice. I think you will find it to be an amazing experience, both personally, professionally, and educationally. But before we jump into that, I want to take a brief moment to even discuss with you why bother having you in clinic. Really, why have you spend time in this clinic, in this environment? Any thoughts on that? Is it just to kill a few hours during the week while you're on the hospital wards, give you a little break from writing orders and doing the heavy work in the hospital? Probably not. One way to get a sense of why to work in clinic is to see what happens in a population in our community over the course of 1 month. See where people end up getting care. This is a concept called medical ecology, to understand how people and their communities interact with the healthcare system. And it's based on some work by Dr. Green and work from 40 years ago by Dr. White, all published in the New England Journal of Medicine. And as you can see from here, if you look at an average community and take 1,000 people, within the course of a month, about 800 will have some type of symptom that the individuals can recognize. Of those, about 300 will consider seeking medical care. They will consider thinking of going to some practitioner. Of those, 217 will actually come to a physician's office. And of those, 113 actually visit a primary care doctor's office. Surprisingly, 65 will go to an alternative medicine provider, a complementary or alternative medicine provider. And then a smaller number, about 20, will actually visit a hospital outpatient clinic. Of those, 14 will receive some home health care, and 13 of the people seeking care will actually go to the emergency department. 8 will come into the hospital with an admission, and ready, less than 1 will actually be hospitalized in an academic medical center. So this diagram demonstrates that most of the patients you're seeing in the hospital represent a thin slice of the people in the community who are seeking care. And more importantly, I think it reveals that most of your life as a physician will actually occur taking care of people in the outpatient setting. That's where people come to seek medical care, and that's where you're going to be providing care. And it is a different type of medical care than occurs in the hospital. So the point of this brief 4-hour per week experience you're going to have this year is really to set the foundation for your entire career in medicine. And that really is applicable whether you're specializing, subspecializing, or staying a generalist primary care provider. So what are the big learnings from this view of ecology and medicine? I think, first of all, a large portion of the population has a problem every month, some symptom that they will seek care for. And the bulk of those people come to a doctor's office like this one here, where you are going to be practicing. Okay, that was the introduction. Now, the details. Welcome again to OHSU General Internal Medicine. You are really here to learn, and I believe, I've been here now 11 years, I believe that you will have an incredible learning experience, especially, even more so if you are open and ready to learn. This practice is a place where you will care for people who deeply need you, and you can make a big difference in the lives of your patients. It is also one of the more challenging places to work. There are definitely easier outpatient experiences than this, but I believe that the reason you selected or should have selected this practice to work in is because it is a huge challenge. You will leave from here with incredible rewards after 3 years. I believe, and I have seen this from experience over the past decade, that the residents who come to practice in this clinic will have an amazing experience and will leave here much better doctors than those who have practiced in other outpatient settings. How can you now make the most of this clinic? Because it is the most challenging practice you will experience in this system. I'm obviously not pulling any punches here with this discussion, but I think the goal is, how can you turn this challenging practice into a wonderful experience? First, this is a medically challenging practice. It is also socially challenging and psychologically challenging for both you and the patients who seek care here. And finally, it's a cultural challenge, again, for both the patients and for you. So why is it so medically challenging? Well, first, you are taking care of the core internal medicine problems. This is not a wimpy clinic. This is the clinic of all of the major medical conditions that make up internal medicine. Heart disease, stroke, hypertension, diabetes, cancer, lung disease, and of course, psychiatric conditions. This is the core of internal medicine, and you will be challenged by it. Next, this is a socially challenging practice. You will see poverty and abuse here. You will experience patients on a daily basis who live isolated and lonely. And you will experience people who come from extreme dysfunction. And, that is just part of life. And you will learn to deal with this in ways that your colleagues in other practices won't be able to even comprehend, and certainly your friends outside of medicine have no understanding of. Next, this is psychologically challenging. You are experiencing patients with all of the major mental illnesses, and we know how that interacts with medical conditions. It means that you are going to have to rise above the patient's conditions and learn the coping skills to take care of people without being burdened yourself by their problems. Next, this is culturally a challenging practice. First, you will certainly have a decent segment of non-English speaking patients who come from very different cultures. And they will also be coming from very diverse backgrounds, both economically as well as culturally. I think it's also a practice that's culturally challenging for you because 90% of the time, really 95% of the time, you are going to be in a hospital setting. And then for this little shift every week, you come into a different setting with different people, and you're going to feel out of the water here and will have to quickly learn how to get back into the flow, into the rhythm of an outpatient practice.